It's important that once you know what stroke symptoms are, that you're aware that a stroke can happen at any time, anywhere, to anyone. My name is Brandon Byrd. I'm the Stroke Program Quality Administrator at Norman Regional Health System. Some of the most common early warning signs of stroke are dizziness, numbness or tingling to your face, facial droop, slurred speech, inability to speak, arm weakness, leg weakness, or difficulty walking. The symptom that is missed most by our patients is sudden onset of dizziness. People typically attribute it to vertigo or dehydration, but oftentimes dizziness can mean that you're having a stroke. One way that we identify stroke symptoms and stroke-like symptoms is using an acronym called BFAST. So that stands for balance, eyes, face, arms, speech, and time. Each of those letters correlate to a set of symptoms. B for balance, if you have difficulty walking. E for eyes, if you have vision changes or double vision. F for face, if you have any facial droop or facial numbness. A for arms, arm weakness or arm tingling. S for speech, difficulty speaking or slurred speech. And T for time. That means all of these symptoms will come on suddenly. It's important to be seen as quickly as possible if you have any of these symptoms. People most frequently wait to come to the ER to call 911 because they think these symptoms will go away. If these symptoms are sudden onset and they meet any of the BFAST criteria, the first thing you should do is call 911 and come to the hospital to make sure it's not a stroke. The ambulance can always get you faster than your family can. So if you call 911, an ambulance will come pick you up and bring you to the emergency department. When you call 911, the paramedics on the ambulance are going to immediately start care for you. They're going to assess if you're having a stroke. They're also going to be able to draw blood, administer medications, and monitor you while you're being transferred to the hospital. Your stroke care will essentially start the second they arrive to your house. The best way to reduce your risk for stroke is to find a primary care doctor. A primary care doctor will help you to monitor your blood pressure, monitor your cholesterol, and help you to determine a diet and exercise plan that will reduce your cardiovascular risk. With a lower cardiovascular risk, you'll be at lower risk for stroke. It's very important to seek treatment immediately if you think you're experiencing a stroke, because the symptoms you have at the beginning of your stroke are the same symptoms that you'll have for the rest of your life if you aren't treated quickly. One of the reasons that it's so important to understand what a stroke is and what stroke symptoms are, a stroke can happen to anyone, anywhere, and it can happen to anyone at any age. So awareness of the BFAST symptoms is important to identifying and getting to the hospital as quickly as possible.